Hello everyone, welcome back to my channel. This is Nurse Mia, and in today's video, we will talk about the nursing skills that we usually perform here in the States so that you can prepare for it and maybe practice some of it. It's always better to be prepared, diba? Okay, let's go. One is assessment, so you have to do a head-to-toe assessment of your patient. Number 2, charting skills. So you have to make sure that you chart everything that you did for your patient and also all the assessment. Number 3, blood draws. So the nurses here actually do the blood draws. Easy lang siya, but you need practice. Number 4 is IV insertion. So this is a skill that nurses really need to practice. But there are patients that are really hard sticks, so you can always ask help from another nurse, or also you can ask help from IV therapy. Number 5 is vital signs, and ayan, master na natin yan. Number 6 is intake and output monitoring. So you want to make sure that all your patients are voiding, and you want to make sure that you chart everything. Number 6 is using a bladder scanner. So you will use a bladder scanner to make sure that your patient is not retaining urine. And for number 7, if the patient is retaining urine, you want to do a straight catheter or a Foley catheter as needed. And in here, straight catheter is also known as in and out catheter. FYI. Number 8 is medication administration. So you have your oral, sub-Q, IM, IV medication, and yun. Number 9 is explaining to family members. So usually you have to explain what's going on with the patients via phone call. Number 10 is calling or paging the doctors regarding patient's labs or if there are any changes in the patient's status. So you want to make sure you contact the doctor about that. Number 11 is incontinence care. So you want to make sure that your patients are always clean and dry. Number 12 is dressing changes. So if your patient comes in with wounds, you have to treat their wounds, and if they have dressings, you have to make sure that you change their dressings as needed and as ordered. Number 13 is skincare. So kahit ano pa yung problema ng patient mo, you have to also look at all their skin. So if the patient's skin is dry, apply lotion. If there's like a yeast infection, you have to treat that as well. Number 14 is ECG or telemetry monitoring. So you want to make sure you can interpret the patient's heart rhythm. Number 15 is NGT insertion, NGT feeding, tube feedings, peg tube, all kinds of tubes. Number 16 is suctioning. So you can do oral suctioning or tracheal suctioning. Number 17 is learning how to use an IV pump and also PCA pumps for pain control. Number 18 is blood sugar monitoring and also insulin administration. Number 19 is your running skills, because you really have to make sure that you can run towards your patient who is a high fall risk so they don't fall. And number 20, the skill that is very important, your patience. Because here, patience is a virtue, and most of the time, your patience will be tested. So, ayun. Patience. So those are the skills that I usually use while I'm working during my 12-hour shift. I hope you learned something from this video, and I would really appreciate it if you give it a thumbs up. And if you haven't subscribed yet, please subscribe to my YouTube channel. It really means a lot to me. And good luck with your US journey, and I hope to see you here soon. Thank you so much for watching. Bye!